Welcome to Alzheimer's Speaks Radio. I'm your host, Lori LeBay, and I'm so excited that you're joining us today. We are going to have a fascinating conversation as usual as we learn from people all around the world at all ages and stages of life. Stay tuned as we shift our dementia care from crisis to comfort.
Here we go. What you think about, you will bring about dementia change. We will.
Well, hi, everyone, and welcome to Alzheimer's Speaks. I'm your host, Lori LeBay, and I'm thrilled you can join us today. We are going to be talking with Crystal Gallo, who is the founder of Innerhive, which is a really cool app that helps people communicate when they care and get educated, and it just really transforms everything to reduce the stress. So I can't wait for you to meet her. But in the meantime, I just want to encourage you all to check out Alzheimer's Speaks for all of our free educational resources, along with our sister company, Dementia Map, which you can search for global resources there as well. I so appreciate each and every one of you. Our community here is just absolutely fantastic. And of course, I always encourage everyone to be a giver of hope. Like, click, and share, not because I care about the numbers, but I care about the people who need this support and they don't know where to look for. So we've all had it happen where something pops up on our feed through a friend or a relative or a coworker that kind of perks our interest. And again, it takes little time and costs you no money, but can make a huge impact in someone's life. So without wasting any more time, let's introduce you to our guest today. Well, Crystal, I'm excited to have you back again. I was intrigued with Innerhive the first time you were on, and I know you've made a ton of changes and are getting some great response. But before we dive into Innerhive, can you just tell our audience if you've been personally touched by dementia in your own family or circle of friends?
Yeah, I sure can. For those that kind of didn't hear the story before, I'll give an abbreviated view. But during the pandemic, like most families, I think people were trying to figure out and they were learning to navigate new situations. And we happened to have one of those situations on our hands. So my grandmother, who my grandparents were very integral in raising me, we had gotten a call and she had an accident and kind of snowballed from there. And she had a dementia diagnosis. So we ended up moving her and my uncle, who she was providing some assistance for as he was navigating cancer. So we moved them across country. And it's a very different experience when you understand the condition, so to speak, or understand the changes that come with it. But when you're living with it and you're trying to continue to learn and adjust your behavior, the way you communicate, how you set up safe environments, that interaction, it changes the game. It's a very different experience. It's very humbling. Has its highs and lows, but yeah, it's something that we had the experience of kind of going through and the privilege of extending care for.
Okay. I'm going to have you kind of give people a little bit more background about Crystal, who you are, how you got to create Innerhive and that whole shebang.
Yeah, for sure. There's a lot of places I can start. I imagine we'll probably keep it to the fun side of kind of where have I spent my effort in terms of a career and how did I kind of navigate to this place. So been in technology my entire career. I've kind of sat in different disciplines. Always had the notion that I wanted to learn a little bit about each area so that I had an understanding. And when I got to a place of kind of running a business, I knew what was expected of people in that role and had a little bit of empathy. And so I've always had a passion for wellness. I never necessarily saw this jump happening the way it did, but after this experience, after connecting with others in the community, other friends, other family members, even other colleagues, I think what was really great is I realized this is something that's a much bigger story. It's a much bigger situation. There's a lot of people that are going through it and they're not talking about it, or they maybe don't have the circle of people to talk to about it, or they don't know how to talk about it. And so having that kind of undercurrent, that common thread was really what inspired our team to kind of create a solution that we wanted to bring forth to families to help them navigate care coordination. So that was kind of the the journey, and it's never linear, right? But it's always full of fun and lots of learning. And so I'm grateful for everything that I've kind of picked up along the way, and even more grateful to be working with a team of people that get it. We've been in that care situation. We've held a family, and it's kind of escalated to, full caregiver. And I think that's really important when you're trying to build something for people and you're making sure that the human aspect of it is not removed, because I think sometimes with technology, it can be scary, and there's an assumption that technology will replace humans. And it's not the case. It's meant to augment the judgment. It's meant to assist. It's meant to make things more efficient. And that's something that we've tried to be very considerate about with how we approach this.
Well, I know when we talked last time, you had talked that, most of your team, if not all, had, some experience with this care journey. Is that still the case?
It is, yeah. We've had a mix of people that have had experience with, as I've talked about, kind of the cognitive decline, cancer. We've had some people that have been in family situations where they're working with family members that have a medical complexity, and that can range anywhere from a chronic condition that started at a young age, all the way up to a recent situation where, there's a mental health situation. And I know that's a broad term, so it's probably not a fair label, so to speak, as we like to give things. But I think that's definitely an emerging trend, is when you're in a scenario and you're extending care and you yourself are so in the trenches and you're so compassionate about helping, sometimes you forget about yourself, and that snowballs into its own situation. But also what people, maybe don't always reflect on is, how is that impacting everyone around you? How are they receiving your energy? How are they observing you? How is that changing how they're feeling? And then that becomes, how do they handle that? So it's certainly a growing concern in terms of making sure that we understand how to communicate and support each other.
Well, and I like that your staff have that experience and that it's varied. It's not just dementia oriented, because there's so many overlaps with just care and what you have to handle and look for and communicate. And you mentioned the self-care, and a lot of people have more than one condition that you're dealing with as well. And then I think it gives some insights in terms of your own conditions and what you're dealing with, and how you
100%.
want to be cared for in the future. That's one of the things that I love, is it brings up questions. I know I'm going through it right now with a family member, and people are like, we don't know what we do without you, because you've been through this before and you can put things in place for us that we wouldn't even have thought of. And Innerhive has kind of all those little circles that'll get you thinking about a lot of those things that it's easy to overlook, and it's difficult a lot of times to handle when you're in the midst of a full-blown crisis. So that is really neat. Now, can you mention when you actually launched, and then what you're witnessing right now as far as families, and has that changed?
Yeah, so we launched a year and a half ago, and it's kind of wild that you ask about that, because when we first ended up introducing this solution, we had the opportunity to connect with families and spend a quarter getting to learn. We still keep that as something, it's really critical just to understand, as things are shifting in our whole economy and communities, it's shifting for families. And so it just grounds us. And early on, we were recognizing, people don't necessarily associate as a caregiver. It's coming out of the pandemic and I was helping family, or I found myself in the situation because of an accident, and then before you know it, it escalates and you're going from 1 week off to helping, to moving in, to taking a leave. And so we've seen a growing shift in terms of people that are coming forward and feeling more comfort about talking, how that journey has shifted from helping to full-on caregiving, about recognizing that there's a skill set and there's a demand and a need to be able to recognize and respect people that are in those roles, whether it's professional or whether it's family. It's just, we live in an era where, what a cool time to be alive, and so much technology to kind of assist, but also so many systems that maybe aren't necessarily optimized for where we're at as it relates to, aging and handling chronic conditions and being a little bit more proactive and preventative.
Well, that's great. I know right now in the hospital system that I'm dealing with is, I know they have their systems for communication, but boy, there's still so many gaps and holes. And I think no matter what system you use, you're going to have that. But when something is easier for family, because it's you're trying to communicate with everybody, and that in itself gets really exhausting, and there's so many elements in terms of what you're dealing with. But some days I wish the hospitals and the clinics had better communication systems, because it's like, well, I know I talked to them about that. They said they logged it in, and then it's not, all of a sudden you find out it hasn't been addressed, and it gets really frustrating and difficult to cope with. Do you have anything in your system like for coping skills for families, or resources as well?
So it's funny you mentioned coping. I think that's an interesting word. I think there's many interpretations that come with it. And, some people might see that as like it's a calm, composed way of handling something, and other people might see it as what can I do to suppress or ignore or avoid. And so I definitely have almost seen it as a last stop before that crisis emotion hits. And when you're asking about like what are the emerging trends, and I think the emotional burnout continues to kind of peak, so to speak. And however you want to bucket that, if it's something that falls under mental health, I don't know. However you want to categorize it, all it means is people are handling a lot of information and they're overloaded, and they're trying to be 10 different things at once and trying to figure out how to sift through. It's taking longer to kind of get out of that crisis mode. And so one of the features that we found really valuable after talking with families is, when they come in and you have an accident or you have a diagnosis or you have something brand new, the first thing that typically happens is you need to collect that information. So you have conversations that are happening, you have appointments that are happening, and you need to be able to pull that all in, because people are going to ask, well, what did they say? Well, what do we do next? Well, what are the medications? Well, it's a lot. It's you're still trying to even just comprehend what this means for you, how to shift the environment, what it means in terms of what is that diagnosis or what is that medication. Hold on, let me Google or let me figure it out. And so we have tried to figure out, like, how do we balance that automation and that human element. And one of the things that we've extended to caregivers or people that are in a situation where they need to capture this information is a really quick and easy way to just go into the app, tap record. It captures real time the conversation, it summarizes it, so you've got an understanding of who was present. You have some of the key topics and themes, and then you've got really clear action items, so things that you can go through and see progress on. But more specifically, you can take all of this and you can share it with your support network, because families were saying, it's so hard to remember the questions. I'm so drained. I'm just still trying to process this emotionally. I can't really be present and be there for my loved one and listening and asking questions and trying to remember it. I'm intended to be an emotional support, a scribe, a second brain, a medical expert, and doing that all at once is just too much. So that was our gift of, we're not going to ask anyone to do anything. We're going to take immediately from their plate and say, here's a quick way of capturing all these important conversations, summarizing it in a way where you just remove the noise and focus on what to do next. And then you can easily share with people that can help, support you in that next step of the journey.
And that's huge, because I had the talk with my family today about the level of attention we're all giving this issue right now. We have someone in hospice, isn't sustainable. There will be moments this person will be alone, because everybody has, private lives, and they need to work, and, they need to survive and thrive in their own way. And then you add this full-time job of all the stuff we're talking about on top of it, and trying to communicate it to others. I mean, it's exhausting on so many levels. So like you said, if you call it mental health, if you call it burnout, if you call it exhaustion, they're all kind of wrapped together, and everybody feels different levels of that at different times. It just depends on their coping skills as an individual. And multitasking, some people, they thrive on that, and others are like, just slow down, give me one thing at a time here.
Yeah.
It's too much. So, and there's no right or wrong way. And then so often then you wrap grief into this too, because it is a crisis and it is new, and it's a big change typically in someone's life and lifestyle and the family structure, and I mean the list can go on and on and on. So the more support we can give people, the better off we are. Why don't we talk about Innerhive and kind of how it's structured first, like what people would find in it, and then how you have found that experience for families.
Yeah, yeah. I think where we just started a minute ago when you had said, like, what's the first piece of value? Like, how can we immediately help people? And, if you think about it, that that tech magic, if you will, is sitting in the doctor's office, sitting in a care conversation. It's tapping a button. It's having our application do the listening. We're not just transcribing it. I mean, we're parsing medical conversations. So we're kind of being that medical expert, so to speak. We're pulling out action items. We're categorizing, like, where should you prioritize your time first or second, and then organizing it in a way that's readable for non-medical people. So it just makes it easy to understand, and it's almost like having, a really smart assistant that speaks fluent in doctor language and also can, speak in our language. And so that's the first thing when you come in. We just want to make it easy to capture those care conversations. But we know that every journey is kind of unique, and it's not necessarily, probably the biggest constant is change. And so we wanted to make sure that we were offering a solution that could grow and be tailored to families as they kind of go through that. And so that's the starting place. But from there, you can turn it into, tracking any sort of care task. You can organize all your documents, your contacts. There's resources in there so that if you need to seek and you're looking for, maybe educational or community or support groups, we've got that. But really, we knew that if we could work with families, and you take dementia for example, it's a really complex situation, and there's a lot of things involved. There's a lot of variables, a lot of emotions, a lot of specialists, a lot of things that are very they're fluently changing and they're different. And so we knew that if we could solve that, then this would be something that anyone, an individual, you could use with your partner, you can use with your children if you have a chronic condition. We're building towards being that operating system, if you will, for family care management. And I think when you think about how things are evolving, and you had asked how much change I've seen in a year and a half, if I could predict, and knowing where we are now with the pressure that's happening on the system, the pressure that's happening, in our culture and community, from an administrative, from a medical, the technology that's emerging, I don't think it's going to take 5 years. People were saying, oh, it's going to be another 5 to 10 years. We've been democratizing care for already a decade. And we've now got tools that are going to help us advocate even more so. And we've got people that are finally coming and feeling compelled to do something. And when you have enough of us collectively, that puts enough pressure to kind of accelerate, the shift. And I think then it becomes about how do you maintain and allow someone to have autonomy and still ensure their safety? So as we continue to go through these changes, I think that's like the tightrope we're walking. We want to be able to have this invisible support, this support that really captures all the important information. It makes it's your second brain, right? But we don't want it to feel like you're losing your freedom, or we don't want some of these other tools that are out there to make it feel like you're under surveillance. And so it's, I think, trying to figure out how do we keep human aspect, how do we make sure that there's a lot of integrity in our approach. That's probably going to be something that's really important for all of us as we think about solutions for families.
Yeah, well, I want to, just make sure that families are understanding, because I had kind of brought up I'm in this crisis, but this is for everyday appointments. You go in now, and
Mm-hmm.
the doctors, for a while, the notes weren't the best because they were in charge. Then they had physical people taking
Yep.
notes, and now they are using a scribe. And then when they spit out the notes from the visit, I mean, I've been shocked. I went in for an Achilles heel thing, and they're telling me to go to, where to go to buy shoes and inserts and therapy, and a lot of those details we weren't really talking about. She had mentioned them, but she knew that was going to be spit out from
Mm-hmm.
their AI system and stuff. So I think it would be really important, to also have this version of it to see what it is, because that doesn't necessarily give you the prioritization, and it doesn't always dumb it down, to our non-medical minds a lot of times too. So, this can be helpful on the day to day. You don't have to be in crisis mode. And I think in a lot of ways it would be healthy to get used to the system now before you are in a crisis mode. So you are familiar with it, and that takes some of the scary out too, when you've
Yeah.
had your kind of toe dipped in the pool already, and understanding what it's capable of doing for you, because you'll be explaining that maybe to other family members as well. and this
Oh, for sure.
and this can be used for all ages. So, if you're bringing your child in, for a pediatric visit, it can help you there just as well. And correct me if I'm misspeaking on any of this.
No, you're spot on. Yeah. I mean, like I said, it's a lot to feel like you have to be the second brain, a project manager, an advocate. And we also have had families express like, I want to be there for all the appointments, but sometimes it's not possible. Sometimes I need to have help, or someone else, or they need to go on their own. And so this really also helps, children that are caring for, adults, partners caring for each other, parents caring for their children. And I use care, lightly. You could interpret that in many ways, but be there to support, be there to help navigate care, in deeper aspects. But yeah, it really helps them feel like I can almost maintain awareness. I'm not losing control. I can help navigate these medical decisions because I've got the right context. It can be hard to remember what happened yesterday. And so if we can approach it in a way that preserves that autonomy and still provides that clarity, that's the sweet spot. So yeah, but we don't just help, you started to kind of go down the path of this is great for appointments. And while that is absolutely a value add, especially in the beginning, um, you know, you can actually turn conversations, and it could be something as simple as we've had a lot of families say, we come out and maybe you have rehab, or my dad just broke his hip. And so now we've got to go through and figure out what does that look like to adjust things at home? What are the different exercises? Are there medications? But most importantly, when we go in for PT or we have, PT or OT come to the house, it becomes how was he yesterday? What did you observe? And so being able to capture those observations are so critical because you can see and you can track the progress over time. And so you feel informed when you have care discussions, whether it's with your family or with, support staff in a movement or a medical situation. So we've got families using it like that. We have families that are using it as their own audio journal. So emotional burnout is one of those things, the emotional toll continues to rise, and you get so immersed in someone else that you forget, oh, wait, did I eat today? Did I take this? How do I feel? I don't remember what I got for sleep. And so even if you log that and you kind of contract that over time, you can get a better sense of, okay, what is my sentiment? Where am I spending my time? How am I feeling? And sometimes that just basic awareness is really helpful because we don't always slow down to think about it. And we make it easy, just a one tap, talking to the phone, share that information. Maybe you want to share it out and you want to let your friends or family or siblings know. And it helps them kind of understand so that you don't feel like you're carrying the weight all alone.
Yeah. Well, I know for me, like just all the doctor's appointments. I mean, there's a ton of them, and
Mm-hmm.
somebody just in a rehab, and then you go home, and then you have home health care, and you have the
Yeah.
nurse assessment, and the nurse, and the PT, and the OT, and the social worker, and I mean, it's a lot to
Yes.
coordinate. And so on my phone, I've just been kind of tracking stuff. What these are the names, these are the numbers, real simple, not even as context, just in a separate spot. And then I have all their appointments, and then of course I add them to my phone. But it would just be easier because I don't have all the other details in
Yeah.
access on my phone. It would be really nice to be able to utilize kind of this one-stop shop where okay, here's the important documents. Okay, you need the do not resuscitate or the healthcare directive or whatever, and you just have access wherever you go. I don't know how many times I'm asked for those papers, and you give them to them and they scan them in and they get lost. And so it's really nice to be able to have the accessibility. And I just kind of bite my tongue going, really, again? Or it might be a bank that needs it, or there's 10 million people that need access to all of those types of documents. And you can carry them around, and that alone takes a lot of relief off. Or what is their med
Mm-hmm.
list? If you've got it handy in one spot, you don't have to log into another portal again, um, to find that stuff, because all these different little cubby holes, it, get,
Mm.
it really gets very confusing. with stuff.
Yeah, yeah. It's very easy for it to get lost. And I think there's also a lot of dignity when you think about documentation because, for any one of us, we can forget what happened yesterday, but I feel like that's even more so the case, with people that have a cognitive situation. Every conversation might be the last one that's clear to them or the last one they feel like they have independence and control over kind of, owning, so to speak. And if we can capture all of those moments and we can organize it in a way that prioritizes here's where to focus without necessarily turning things into right. There's a lot of emotion, and when you ask too many questions or you get frustrated because you forgot or you don't know where it is, some people take that as interrogation or you're challenging them, and then you've got this elevated emotion. And so if we can just avoid that situation and keep everyone calm and bring clarity to the situation without it disappearing into the fog and these little cubby holes that you speak of, uh, that's huge. That makes a big difference because our end goal is to prevent these situations. Our end goal is to keep people at home. It's to focus on quality of life, not just for the care recipient or the individual kind of navigating some, care complexities. It's also for the person that's there in support, that's extending care. Their wellness is just as important, and it's very easy to kind of have oversights and miss things. So
Yeah. Oh, it's really easy to have oversights and miss things. And I love the prioritization of what you need to do because sometimes that alone can be overwhelming. And I would imagine like for appointments, it'll log who people are, the doctors and the names and, contact information. And
absolutely.
does it have
Yeah.
does it have a calendar for appointments and for tracking?
It sure does. Yeah, you can hook it up to your calendar. So if you have a shared family calendar, if you have an individual calendar, you can add all of your appointments, and so you'll get reminded. And when that appointment comes up, it will say you have a doctor's appointment with Dr. Susie, your neurologist, in 5 minutes, and then it will also say, would you like to record? That way, we're being your second brain. We're helping you remember. We're going to go in. You want to capture this information, and then at the end of it, it's going to say, would you like to share with your inner circle? And you get to determine who is in that inner circle, your closest community, the people that you've let into the hive as you've built it. And that just makes it really easy so that you can share as you go. And it takes the load off of you having to repeat, you having to manage multiple calls or text chains. So yeah, we've absolutely, the appointment management is in there. And we've also got medication management. So you could very easily take a picture of your medication and you can upload it and it captures that. And so something that was recently that came up with a family, they reached out and they had shared something, they were like, we weren't expecting this so soon, but basically their dad had surgery, ended up on some medication. He ended up with an infection. They didn't realize it was an infection, but they were using the recording device as a way to log observations. And they noticed after a couple days in a row, they were like, Dad was kind of confused. He was foggy. We thought maybe there was something new that was happening. And when we ended up going back and meeting with the doctor and we had shared our observations, they ended up doing deeper research and found that he had an infection that was actually causing some of this confusion and this lack of clarity. But had they not logged that and then been made aware of, hey, here's a trend, could it have been from this medication shift or something, not happening here? And it illuminates patterns that you maybe otherwise wouldn't recognize. And sometimes it's nice to have that second brain there helping and calling out, here's where you can spend time, or here's where there's a gap, or here's what can be done differently.
Well, and I think it can also help with family members who go, I just visited, they were fine. If you're recording something specific, it's like, no, this really happened. I know we had a situation occur, and I was so glad another family member heard what I heard because it was something that was no one would believe, and we both looked at each other like, what's going on? And that really helps. So I can see it helping in that fashion. Can it track like tasks of things to do, like laundry and meals and shopping and all of those things?
We don't necessarily have a task manager or to-do list right now that you can customize, but from all the conversations, it can track all of those tasks or action items, and then it can serve it up. So you can interact, and if it says schedule this appointment, it'll pop up with a reminder and say schedule an appointment. Would you like to call? It might have, complete this paperwork. And so you can go through and mark off so you can get that satisfaction as you're doing micro steps every day. We are exploring to see kind of if people are looking for a place where they can, on their landing or on their homepage, just say, no, these are the 5 things that I believe are my priority today, and I want to add them in, and then I want to be able to cross them off the list because it feels good to get stuff done.
Okay, because I can see where the task manager would be helpful versus having to go to another app for that,
Yeah.
when you're coordinating things and stuff. Any other features that we haven't talked about?
I mean, something to that's just of note is when you do go in, and if you have these recordings, you have the ability to add your own notes. So you've got the audio, full transcription, summary. But if people want to add notes on top, we find a lot of families sometimes after an appointment or after, a home visit or whatever that may look like, they want to add additional notes. So it just helps for reference to track over time. And you can absolutely do that. And then you can choose who you want to share it with. So if you want to share it with your inner circle and your community, you can choose to make that a public note and then it'll post to kind of a feed. So that way, when you've got family and other people that are supporting you, friends, whomever, they feel like they're in the loop. They feel like they're part of the journey. And so you can share updates. You can also share in that same space, hey, I need help with, maybe going to an appointment this week. Can anyone jump in and assist? Here's what I'm looking for. So it's just a great way to bring transparent conversation into the mix. I think that helps build a lot of trust. It helps people feel like they're connected. Um, People help in different ways, and there's no one size fits all for helping. So that was kind of our way of how do we give people that option? Food, transportation is always important. Going to some of these appointments are important. Extending the care at home. So there's all sorts of different ways.
I also wanted to ask in terms of, you had mentioned, it would post, and I would imagine it would post to, the hive and whatever level. Do you have, because some families like to have kind of a more public exposure where they're documenting kind of updates and stuff. Do you have anything like that, or have you explored um, kind of like almost like a blog post for
Yeah.
Okay, you want to tell us about that?
Yeah, so I think that was a nice little softball in. People are probably familiar with some of the social platforms that exist out there, like Facebook, Reddit, maybe some specific ones, like Caring Bridge. And so the space that we have is a community space. You can choose who you want to invite to that. And so it is absolutely possible that if you want to post any sort of documents, pictures, updates, asks for help, you can do that and you can control who you invite. So in a very quick copy the link, you can send it off through text, through email. So it's a very fast and easy way of inviting people in. And some people can just come in and view. So if you just want them to see and they just get updates, you've got that ability. And then if you want people to have a little bit deeper interaction, there's the opportunity to be a co-owner. And so that co-owner is someone that can also add, maybe they want to contribute more photos, or they want to also, share updates in that same space. So you've got that flexibility depending upon who you want to invite in. But absolutely, the family can control that. It is a central space. It is intended to be the communication hub. There's different parts of the app. Like I said, people can journal, express how they feel. You can, also journal what sort of care are you giving? Are you, doing meal prep? Are you doing medication management? Are you running to appointments? And you can see over time that relationship, how as care complexity and time goes up, how am I feeling? Is my battery low? Am I not feeling great? Am I not getting time for myself? So we've got different aspects to really cover helping people get connected, helping them feel informed, and then also feeling like they're able to prioritize, wellness with some emotional support tools.
Have you had other requests from families of things that they'd like to see in the future at all with the app? Or
That's got to be a trick question. I think everyone, right, when you are going through something, there's different ways of how you handle it. You're also at a different place in your journey. So I can tell you that if I could clone our team and if we had indefinite time and resources, I think there's a million different problems that families have been really gracious in terms of elevating and saying what they want and what they need. I think that's actually made our job harder because we've had to kind of sift through and understand, okay, of all of these requests, which ones are the most dominant? What are we hearing the most of that's going to serve more? Because if we can get to that, and that's a deeper degree of value, then we want to address that first, and then we want to get to these other. So it's really, really hard to be able to prioritize and take feedback because we've had some really great families sharing here's what I could use or what I love. Or, even when we first started, we had said, well, we don't want to be a resource center because we know resources are really hard to govern. They shift, they could be good today, bad tomorrow. I also really wanted to make sure that what we were extending or offering to the community was something that was trusted. And that's a really difficult thing to manage. And we continue to have people say, where do I go for this? And then the next question would be, well, do you trust it, or do you know anyone that's had a good experience? And so we realized that even though we felt that was a really difficult space to be in, there's a lot of resources out there, people didn't care about all the resources out there. They wanted a tailored, trusted space. And so we actually have a space for the community that allows anyone that's within Innerhive, if they've had a good experience with an organization, if they found, great experience with educational stuff, it could be a book, it could be a podcast, it could be a course, it could be a service, someone that was able to come in and provide companionship. Whatever it is, we want them to be able to pay it forward and share. And so we have a resource space that families can say, hey, I had a great experience with ABC dementia. They really helped me understand how to manage this situation and that how I was looking at it wrong, how to reframe it. They can submit that and it goes into a resource catalog, and that is shareable with anyone. You don't need to be an Innerhive user. We don't ask anything. No one is paid, sponsored, promoted. It is community driven. It's just people in our community that have had a good experience. They're elevating it. And you've actually got the option to then go in and kind of rate it so you can see how other families are experiencing it. What I can do after the show is I can share some visuals around this, and then if you wanted to share with any of your users, you can kind of see a little bit more of what we're talking about. I think it makes it easier to ground when you're like, okay, that's the visual of what we're working with.
Yeah, I think that's really helpful because things do change a lot. I'm right now looking for a memory care, and the executive director left a few months ago, and another person left, and then now my last really main contact left, and it's like, okay, that's telling me things have shifted because none of these guys were going to leave, and so it is really interesting, and all services are driven by people and their motives and their personalities and what's a match and what's not, and what might work really well for me might not work really well for you just because of personalities or expectations that we have. And so that is a really tough piece to go, and things shift all the time, and it's getting harder for families to find the services, especially with all the cuts going on now. There's, I'm glad to see the doctors are scribing now too, because they have less staff to help support some of the questions and stuff that are calling in. And many times you're calling in and you're getting an AI, and you're like, no, I want a live person to open up my file and know what I'm talking about, and so being able to help with this organization, because when you're running on full, it's overwhelming, and then you take it to the level where you're exhausted, it's harder to keep things straight. So being able to have that help organizing things is really, really critical, I think. Is there anything that we've missed talking about, Crystal?
Oh, I'm sure. I'm sure there's something in here somewhere that we didn't get a chance to kind of unpack, but I think probably in terms of, where people can explore, my ask of everyone listening, my ask of people that are just an individual on their own journey, maybe someone that's just thinking about the future and they want to be proactive, like you'd said. I think planning is an indispensable discipline. Plans may not always work out. I think they certainly go awry quite often, but just being able to think about and understand, like, okay, what should I expect? What questions? How can I start to get this information organized in a way that when I get there, will help me get through the situation more efficiently? I think any of that feedback from people, no matter where they're at in their journey, that's what we're so hungry for. And so for anyone listening, our biggest ask to you is if you can share the word, if you know anyone that would love to, needs help getting organized, needs help getting connected or informed, get this to them. It's a super simple tool. You may not use everything, but if you can use one slice of it, it helps you somewhere. That's gold to us. And what we're hoping will happen is as we get more users and more families, and your question earlier of like, do you get requests? We're hoping that it's going to continue to bubble up and we're going to continue to get more people saying, this is where it's so valuable for us to have someone helping us solve it. And I think that service plus software pairing is a really unique and powerful thing in terms of like, how do you help families go through? I don't think one is ever going to be perfect. And I certainly don't believe technology should ever remove the human aspect of it. So even when you were talking about the interactive AI, I think that's a great first line. And I think you can certainly get some insight and questions, but I think, finding someone that's been through it, someone that has the emotion, the empathy, someone that you can have a little bit of a deeper conversation and maybe sometimes just a companionship. I think a lot of families crave that emotional connection, and it's important not to negate that.
So this is one question. You said you kind of had that community space for resources. Is there community space for people to hook up with other people dealing with if it's dementia or cancer or just caregiving in general?
Yeah, we don't have that, but that is a request we have gotten, and it has been a quite a popular one recently. So we have certainly explored what does that look like in terms of opening a space for everyone, that's in Innerhive to be able to share and then invite others. And because we've developed this resource catalog and now we've got some of the tools to kind of help you organize information. So the next thing people have said is, well, can you bring us together so we can talk and we can say what we did and how we use this and what that looks like, because, everyone uses technology and solutions differently. So yeah.
Exactly. Well, in terms of sharing, I always ask everyone who listens to our show and is part of our community, I call it to be a giver of hope. Like, click, and share, spread the word. Doesn't cost you any time or very little. It doesn't cost you any money to do that. And most people, have a hub if they know it or not. If they're on Facebook and Twitter and LinkedIn or just talking with their friends, over a cup of coffee or a cocktail, whatever it is, those gentle little things are important because it says you thought this was good. Versus sending people off to Google, and that just gets overwhelming because it's listed, but is it a paid for ad? Is it really good, or is it just, trending at the moment, but for what reason we don't always know with those things. So that stuff is very, very important. And then, can you talk a little bit about, I would imagine there's a subscription cost to this, or is there a free level as well?
No, so both. There is a free level. So it was really important to us. We, in the early stages, having had the experiences we had and having talked with families, one of the biggest challenges is when families are already overwhelmed and taxed, they don't have the time, they don't have the money, they don't have the energy. And we wanted to make sure that we weren't adding to that. So we very intentionally made a free version where you can access all of this. And then we started to talk with families to understand, okay, what are some richer features? So once you get through getting organized or connected, like, what do you want to do next? How can we support you? How can we grow with you? And some of those richer features are what you'll find. So if you want multiple, unlimited documents, if you want unlimited recordings with summaries, if you want to be able to have multiple people that are at the admin or co-owner level and going in and you trust and they're adding and removing, those are some of the richer features that you'll see that will be part of the subscription. And so that subscription, if people opt into that, would be $10 a month or $100 a year.
Okay.
Or I should say $9.99 a month, $9.99, $99 a year. I always round. Probably I'm like a financial person's nightmare.
Yeah, and that's very reasonable. And then another question some people might say is, well, what if I use it for a while and I don't need it? Let's say the person they're using it for maybe has passed. What happens to that information?
What happens to the information that they've logged in there? They own it. So there is the ability that it is all encrypted. So we took data ethics very seriously. We worked with some consultants when we first started to really understand when you go through, a lot of organizations have to be HIPAA compliant. And so there's a number of procedures, process, and training that's required. And so we integrated that into our practice. And then we also work with AWS, which is the Amazon Web Service, which is where a lot of the data moves and is stored. But mostly what's important about it is they have the utmost security. And so this is something that if someone chooses to no longer use it, or if they've passed or whatever it may be, they have the ability to delete their account, and then that data eventually will be deleted. So
okay. And I didn't know if they went from a paid and then came down to a free one, if that's possible, too, where maybe they think, oh, well, maybe I'll come back, but we'll switch it up for a different person, or I don't know how that would
Yeah, you
work.
can absolutely do that. What I'd love to extend to everyone here is if people want to go and explore, we are on the App Store, we're on Google Play. You can also use this on a desktop version if you like to work on your computer, or maybe your iPad. But there is the ability to go, and if you want to explore all of the features and then figure out maybe the free is good enough, maybe you want some of the richer features, but I'd love to extend and hoping that you can share this after. If people use the code build your hive when you go there, and I'll send you some instructions, Lori can kind of share it with the audience, but this will give you access for 3 months free. And this way you can go and see, do I like this, do I not? And even though I want some of that feedback in terms of what's missing, what do you like, just as much as that feedback, I want to know what don't you like. Because if we're not doing something right, or if we're not doing it well, or if it's not simple enough, if we're missing the mark, that doesn't feel good. Our intention is to try to help family caregivers, and our goal is to focus around wellness and to end the burnout. And we can't do that if we're not solving the right things. So good and bad feedback carry equal weight. They're both imperative to improving.
Well, Crystal, thank you for taking this time with us today. This has been a lot of fun, and it's fun to hear how you've expanded and kind of futuristic things. I love your ethical stand on stuff because that's not always out there, and to me that is critically important. I love that you just said, hey, we want to hear about what you want, but we want to hear what's not working.
Yeah.
That says you're in it for the right reasons, and you're really here to help the family. So thank you for your work. Now, people can reach out to you by email at hello@innerhive.com, or you can just go to the website innerhive.com. I would imagine there's a contact button there as well. You are on LinkedIn as Innerhive, Instagram as Hello Innerhive, and Facebook as Hello Innerhive as well. So again, I ask you all to be a giver of hope. Like, click, and share. Spread the word. None of us know when we're going to need this, but again, it's something we could really apply in our daily, individual or family lives very, very easily, to save a lot of time and energy. it's you can either use free portion or the fee, which again is very, very reasonable. Now, do you have like family packs? So let's say I'm a family of 5. Do you have subscriptions that work with that as well? So you could have mom, dad, the 3 kids all have kind of their separate thing, but yet packaged together?
Yeah, it's a great question. Bonus is we had so many people in the beginning say that we want to be able to share this with our family, and it was really important that we made it approachable from an access and a monetary perspective. And so with that subscription, if you opt in to that $10 a month or 100 a year, you get unlimited co-owners. So you can share among your family. So you can share it with your partners, you can share it with your children. That way you can manage, whether it's, and people can, we have a couple families that actually use this, and they're really big animal lovers. And something for them that's important is they're afraid of going in and having ambulatory or a situation where they may have to go to the hospital and their animals are left alone. So they've actually even created a plan, and they've organized information. So if something were to happen, here's whomever needs to step in. This is what it looks like to take care of their dogs. So they've been really proactive in thinking about that too. So you can use this in so many different ways, but yes, it is absolutely intended to be shared among family, at a very equitable, approachable rate.
Okay, I get the share part. I want to be clear on where I was coming from. I'm wondering if you could have accounts that would track, let's say, a child's need and a parent's need within that, so that they're separated. Because I'm in my mind, I'm thinking this is kind of a one person primary focus, then you develop the circle around them. But my question is, could you have a family unit each kind of having their individual circles within a big one, so you could scribe at the doctor, and you could track their appointments for each individual within a family, and then still be able to share? on different
You
levels.
sure can. Yes.
Okay.
So there's an ability in there where, let's say, if Joe is my dad, I can organize all the information for Joe from all of the documentation that we need for HIPAA, power of attorney, all that. I can put all the routines, the medication, the diagnoses, any contextual stuff that's really valuable to understand how to engage, how to make sure Joe has a good quality of life. And I can build out that visual to understand what's happening in his community, his primary care specialists, his living, any of the finance and legal stuff. And then if I want to be able to switch, there's a very easy toggle. So let's say maybe, my son is Oliver. And so I want to also have all of this information organized for Oliver. So me being one user, Crystal, if I were to have Crystal at crystal.com, I can have both of those people built out and under my account.
Gotcha. Okay, sounds wonderful. Well, thank you again so much for your time. I think this was a really interesting conversation, and I'm sure my audience will find that as well. And I appreciate you also extending that 3-month offer for people to really explore as well. And again, that code was Build Your Hive, if you decide to take advantage of that. Thanks, everybody. Bye now.
This was awesome. Thanks, Lori.
Bye-bye.